this analysis is of the first season of the RSV vaccination program in the UK for pregnant women to protect their infants against RSV. So in the UK, like many parts of the world, RSV is a major cause of infant admissions. RSV bronchiolitis, breathing difficulties for babies, difficulties feeding. Every winter, we see pre-program about 20,000 infants needing admitted to hospital for care, plus many more attending emergency departments across the country, because parents are very rightly concerned about the baby who's off food, who's breathing fast, having difficulties breathing. So RSV vaccination is such a wonderful tool. We are absolutely delighted to have been able to introduce the program to the UK, and that program started across the UK in September 2024. And this evaluation is the evaluation of the first season, and it follows through just short of 300,000 babies in that first season. The UK program is one of the first programs that's introduced using the same schedule as the WHO recommendation, and that is one of the things that makes this analysis different from some of the others. So in the UK, we vaccinate from week 28 of pregnancy. So WHO recommends that essentially at the first antenatal appointment, as you come into the third trimester, is the sweet spot for getting vaccinated, and that's where we aim for as well. So that's slightly different from the Americas, where typically there's a 32 to 36 week window, and we give all year round. So we're giving every baby a chance at protection rather than programs that might be more seasonally designed. And this is a really nice set of findings that we've got from being able to follow up quite so many babies. So the headline is that we're getting over 80% protection against needing hospital admission because of severe RSV. So really reassuring to mums thinking about vaccination and protecting baby. This is making a real difference to keeping babies safe from RSV episodes. Nobody wants to see babies in hospital with these awful chest infections that can follow an RSV infection. And we know that around half of infants will get infected from in their first year of life. As an expectant parent, you have no idea if your little one's going to have a mild episode or if they're going to have a really horrible episode. And this program gives that kind of reassurance that baby is going to be well protected when they're at their really, really tiniest. We're going to be following up longer run. The first season, the vaccination programs are quite close to the season. So most of the data is actually coming from children less than 3 months old. It's great. This is when babies are most vulnerable. They've got teeny tiny airways at that stage. And so the kind of RSV infection inflammation that happens in those airways is being prevented when babies are their smallest and most vulnerable. Our studies also got important findings in terms of being able to show that preterm babies are protected. So this is where there's at least a 2 week interval between the vaccination and the birth happening, same as for the headline results. So there's still really good protection for preterm babies. And our study being at this kind of program level scale also means that we're able to look, as the program came in, we had mothers getting vaccinated at different points in pregnancy. And so we've got some different intervals between the vaccine being given and when the baby's born. And we actually see that vaccination where the interval is at least 4 weeks between when the vaccine gets given and when baby gets born gives really nice protections, closer to 85%. So that's really strong protection for baby from the moment they're born, as long as there's enough of an interval. So for us in practice, this means giving vaccines, as I said, quite close to in week 28 or as close to. So obviously that's UK schedule and that's the WHO schedule. So that works nicely, and it gives a chance for preterms to get protected. It protects term babies nicely. For places with other schedules, then I think still trying to give early, if you've got a 32 to 36 week schedule, I think trying to get your immunizations done in week 32 of pregnancy is a really good option. But yeah, this is our chance to share with colleagues in pediatric practice and maternity services internationally some of the findings from immunization against RSV in England.